You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Laurel Pickering, BHC President and CEO.
Hi, and welcome back to the BHC's Be Health Connected podcast. I'm Laurel Pickering, and I'm excited to discuss our recent annual meeting where nearly 300 healthcare and benefits leaders from across the nation came together to discuss how employers can drive meaningful change in healthcare, something I think you all know I'm very passionate about. There was a lot of energy in the room, and I know I left feeling inspired and hoping that we gave our members new ideas that they can implement with their teams to further the value of healthcare they're providing to their companies, their employees, and their dependents. And joining me today are two of those distinguished members, and they happen to be on the board of BHC. Alison Casler, Senior Vice President and Chief Human Resources Officer at Drury Hotels, and Misi Holmberg, Director of Benefits at Panera. Alison and Misi, thank you both for being here today.
Thank you for having us.
All right, we're going to dive in. Alison and Misi both attended the conference, and we did actually ask them ahead of time to be ready to share their views with all of you, our listeners. And to kick things off, I'd love each of you to share one key takeaway from the meeting that you brought back to discuss with your benefits team. And granted, it's only been a day or so. So if you haven't actually had the conversation, understandable, but what's on your mind to talk with them about? So maybe Alison, starting with you.
Well, it was a great session and there are a lot of takeaways, but the one in particular that we already met on Friday, the day after the conference, was to really challenge ourselves to take a fresh look at plan design, to determine if we might have a plan in place that drives the desired behaviors. And here's what I'm worried about. Perhaps are we funneling team members who are looking for the most affordable plan into our high deductible plan? And if so, is the lower premium perhaps leading to avoidance of care and possibly then high cost claims down the road? So we've been looking at alternative plans like copay only plans to get another option for our team members that have lower monthly premiums. But the takeaway from one of those sessions was if our research does find that we have some unintended consequences of our current plan design, then that's certainly something we want to take a very close look at. Someone during the course of the day made a comment, what you pay for signals what you value. And that really resonated with us, especially as it relates to plan design.
Gosh, I love that you picked out that comment. I think that says a lot and can be a mantra for for folks in your roles trying to provide this benefit. And I also love that because affordability was a big topic of conversation. And I know with both of your populations, you have lower paid sort of workers and lower paid populations. So that certainly should be a consideration.
Sure, quality, affordability, and equity were the three big words used throughout the conference that resonated with our team.
That's great. How about you, Misi?
I think for me, it was the discussion around communications and how to have more of those bite-sized communications, especially because we're in the middle of open enrollment. And I think the one that kind of stuck with me was the idea about office hours, because we've started doing that a little bit more when we've had position changes or we're going to redeploy something that is going to be a little bit different to the field. And I think we could easily pick up that idea within the benefits team because we do get a lot of questions and a lot of times it's the same types of questions throughout the year. So maybe we could schedule, quarterly office hours or something like that. So folks could just come in, ask questions in a safe space if they had specific things they wanted to talk about or even, individually and sign up with us to do that. So we haven't had a chance yet to talk about it, but that was one that I thought was kind of an interesting idea.
Yep, I love that you picked out communications, Missy, because we talked a lot about new models and how employers can drive change at the conference, but change won't happen unless your employees understand and vote with their feet in a lot of respects. So I think communications is a really big part of all of this, right? So
Right. Yep.
great. Well, as you know, the event was 2 days after the election. And so, of course, we kicked off with a post-election recap, and we were thrilled to have Sean Greminger, who's the CEO of the National Alliance for Healthcare Purchaser Coalitions, our umbrella organization, with us. And, BHC does try, to focus on tracking policy and legislation that influences employer-sponsored benefits. And Sean highlighted the recent election results and some of those implications for benefits and our employers that provide them. Could you share your thoughts on that and how it might impact your organization, the recent election results? Maybe Missy, start with you this time.
Yeah, I have to shout out to Sean for, being brave enough to take on a topic like that 2 days after the election. That's, that takes some guts there, but I know he spent some late nights getting some slides updated. So we appreciate that. I think the one, it was certainly all the ACA talk is interesting to us. I know we don't have the individual penalties anymore, but the employer penalties still, cause some friction for us. I'd love to see updates to that. We'll see what happens. But I think the PBM reimbursement strategies are, to us, something that we really want to keep a close eye on. I know there's some recent lawsuits floating around with a couple of companies around PBM reimbursements and how their contracts are structured. So I think that's something that most employers are going to be keeping an eye on as those kind of work their way through. But as we continue to look at even just market checks or renegotiating contracts, I think that'll be something that more transparency will be coming forth. And we want to make sure that we've got that in our agreements and that we're doing everything we can to make sure that we are, being prudent fiduciaries and doing the best we can to make sure folks really understand what they're paying for.
Yeah, I think a lot of us will be watching that, especially around PBM legislation. And I should have said at the beginning, it's okay for the two of you to have a similar answer as well. So I know, Alison, you and your team also are tracking with PBMs and what's happening in that space. But how about over to you on thoughts about Sean's presentation?
I certainly thought it was really well done. I echo all of Missy's comments, and that was the same takeaway, was it relates to pricing transparency with the PBMs. I think the environment seems right to be able to move some of these policies across the finish line and ultimately improve affordability. So that I took a lot of notes in Sean's session, and I thought he covered a lot of really great topics, but that is the one that resonated most with us. Is we've really got to make some big strides in transparency, and we look forward to hopefully some movement there.
Yeah, I agree. Well, as you know, too, each year we feature a member who exemplifies excellence in employee health and well-being. And this year we honored Barry Waymiller, whose president and CEO passionately supports their well-being incentive programs. And we had the opportunity to view one of their videos. They have a few videos that they have created for their employees around open enrollment and their wellness program. Could you talk a little bit about how support from senior leadership sort of influences employee participation in wellness initiatives and other things that you're doing in the benefits on the benefits team? We thought it was so important to highlight the senior leadership engagement, and it really does make a difference. But I'd love to hear from your perspective, Alison, maybe starting with you.
Sure. I have a lot of respect for Barry Waymiller and their various companies, and they've done a remarkable job of creating a culture of care and concern. And the video that they shared about their Better You program, it was really well done. We have 85% of our team in a frontline role, meaning they don't sit at a desk or a computer all day. And so the importance of communication at that level is critical. And I left so impressed with Barry Waymiller's approach to that program in particular. I have a very small minor example, but something that we've done that makes a difference. Our executive team conducts hotel visits every single week of the entire year, so that throughout the course of the year, we visit every one of our hotels and our team members. And during those visits, we host team meetings. Part of that meeting is to give the team an update on what's happening with the company. And then the other part of the meeting, perhaps the most critical, is to answer their questions and help them feel comfortable with the environment and what's going on. We've learned through team engagement surveys that mental health continues to be a topic that is increasing, people needing help, asking for support. And we have a lot of really great programs. But what we did in light of that uptick in comments on our engagement surveys was incorporate that specifically into our hotel presentations. And so when you have an executive leader standing in front of your 30, 40, or 50 hotel team members and not only explaining the program, but sharing a very true and personal story about how that program has helped them, me included, with certain, things that happen in life, really has increased participation in that program overall. And I think it's just the sincerity of, hey, we all have challenging times, and whatever that might be, here's what it looked like for me in the last year. It really has increased overall participation in our overall mental health and well-being program. So that's just a simple example, but something that has worked well for us.
Yeah, that's a great example, Allison, and it's what I have seen work in many companies. Missy, your thoughts on senior leadership engagement in programs and communications?
Yeah, I mean, I absolutely agree. I think Barry Waymiller does a great job. I don't know if I could get some of my senior leaders to be that silly on video, but it looks like they had a great time, and they're definitely entertaining and engaging. I have a similar story kind of about mental well-being. Last year during Mental Well-Being Month in May, we had pulled together really tried to have a safe space where people could come together and talk about their mental struggles, mental health, what our EAP could offer, and all of those kind of things. And we had several folks from senior leadership on down who started the call and shared their own personal journeys. And I think that really helped people feel like they could open up, or even afterwards reach out and go, hey, I'd love to talk to you more about that, or I'd like to get more information about how you worked with that. And so it was really inspiring to see people be that vulnerable, but to say, this is what I went through, and I want you to know it's okay if you need help to come to me, and I will do whatever I can to help point you to the resources we have. Because so many times, like Allison said, we have some great programs and people just don't know they're out there. So the more we can bring those to the forefront, I think really helps a lot.
I love that your two examples are on mental health, because I think there's a stigma, right, with mental health, and raising your hand and saying, I need some help, and to have senior folks or just others that they even work with say it's okay, and we all have sometimes need help, and we have great resources at our company. I think it's really important. So I was very excited about the employer panel, and my goal was to expose our members to new health plan models. We had one employer, First Busey, who is working with one health system in their headquarters town. We had one employer, Purdue University, who has worked with a traditional health plan, Anthem, with their current carrier. And they've worked with Anthem to offer a curated network to their employees and families. And then a panelist who was previously with Northwestern Mutual, where they rolled out a new non-traditional health plan, Centivo. So what were your impressions of their approaches to employee benefits, and what ideas resonated with you? Missy, let's start with you.
Yeah, I mean, I was, very impressed with the way they were able to really embrace some out of the box and non-traditional ideas, and, just really push those to the forefront. We've been trying some things like that as well, like the narrower networks, the copay only programs, and we've kind of dripped them a little bit. We didn't want to just completely replace things, but we want to make sure people understand what they're signing up for, because they are different. And we do want them to understand either the limitations or the parameters that they have to work within to get those kind of discounts. But I really think those are going to be the type of programs that are going to help push some of this savings without just cost shifting to employees, which is what we all tend to do whenever we get those increases every year. So we're really looking at the copay only programs, I think, will be a big driver for us, not for 25, but for 2026, because like I said, we really want to make sure we've got the right plan set up, that we can educate people about how different this is. We know people don't understand the plans we have today, but then trying to shift something like that on them is really going to be another big change. So we're going to spend most of 2025 rolling it out a little bit, showing people what it is, how it could be different, and how we really think that could make a big difference for them.
I feel like
Alison?
I could say copy paste, because Missy and I had very similar takeaways. I did really enjoy the panel segment. I thought it was really well done, and the whole bifurcated networks or narrow networks. We don't do that today. We've had this thought process that we're across 26 states. It's really complicated, but the reality is it can be done, and it's worth doing. And so we're going to take some time to continue our research on the copay only programs and alternatives out there. We're going to evaluate that in 25 with the hope of doing something for 26, but also looking at, we have markets like St. Louis or San Antonio where we have a really heavy presence, and we could certainly do some more narrow networks that, while might seem on the surface more administratively cumbersome, somebody said the extra effort is worth it if it's good for our employees and good for our company. And we are willing to put in the extra effort if it's the right thing for our team and for Drury. So that really was my biggest takeaway in that section. But I thought the three employers and the panelists did a great job. That was perhaps my most favorite part of the conference, because I think when you can hear employers put things into action, then you start thinking, wow, a bank has a similar footprint, or you just think about the parallels and similarities, and it makes you walk away thinking, I can do this. They did it, and I can do this. And so that was perhaps the most motivating and uplifting part of the conference for me.
I'm so happy to hear you say that, Alison, because I think that's a big value that the coalition brings to our members, is to highlight where employers are having success in trying new things and getting good results. So glad that was your favorite part. We also had Morgan Health speak, and I think Morgan Health has some of the most innovative thought leadership in employer-sponsored healthcare. Dan Hartman, who joined us from Morgan Health, talked about innovative models and fresh approaches to benefits. Some of those examples were primary care, affordability, data and employers' access and ownership of their data, health equity, or the lack of in the commercial population. It's not just an issue for Medicaid and the uninsured, which I think some people only think of it that way. Are there any of these ideas that stood out to you? Any that you might want to learn more about or are thinking of focusing on in your population? Or any thoughts on my conversation with Dan?
Yeah, I think for me, one of the last comments that really stood out was around we end up treating disease and not treating, getting in front of it and doing more prevention. And I think we certainly have to treat the disease, but I feel like we do ignore that preventive part a lot. So that one to me really just kind of stood out, because I know we've struggled with, our screenings every year are definitely below benchmarks, and we've tried all different kinds of things and they keep going down, which is driving me crazy. So trying to think out of the box on how else can we get these, very easy to do things in people's hands easier. So one thing we're working on for early 2025 is at-home screening tests for colorectal cancer. So you can order them now. They don't cost you anything, but it takes a couple steps to go do it. We're going to send an email to you. All you got to do is click on the link, type in your address, and it'll come to you. So we're trying to figure out if maybe making it even easier to do something that should be easy now, but people just don't take the time to do it, can help with some of those kind of things. We keep trying a lot of things and not getting a ton of return. So we're going to keep trying different ideas, but hearing just some of the ideas around health equity and all those kind of things and social determinants of health, maybe there are just different ways of looking at it that we haven't thought about that might make some differences. So yeah, again, it kind of comes back to communication and all of that type of stuff, but we're going to keep trying.
Yeah, and I love that you brought up at home screening tests. And I think there's just a lot more conversation about what can we do at home. And I've even heard presentations recently at other conferences that I've gone to about hospital at home. So how much of this can we move to the home where people are maybe more likely to engage? It's less expensive and those kinds of things. So Alison, thoughts on things that stood out for you?
I just think in general, my takeaway in this segment was healthcare is a big problem. It's a big challenge and it can't be solved with just one solution. And so the creativity, Missy, that's a great suggestion that you guys are going to tackle. How do we get it at home? There's just, it just takes time getting out of the routine and the minutia and the day-to-day busyness to step back and say, let's think about who our population is. What are we trying to achieve? We too have thrown things out there. The stick rate is not very good. I don't think at the end of the day, our team understands most of the challenges. Many of them view the emergency room as their primary care physician, which is just maddening. And so we just have to be willing to get creative, not afraid to try new things. And we're not afraid. We just haven't had tremendous success with many of the things we've tried. And so we've talked about the importance of getting our benefits team out to the field, in our case, out to the hotels. We don't have on-site HR. It's all done here in St. Louis. And so do we take our show on the road, and do we sit in break rooms, and do we have conversations in multiple languages? And nothing rocket science, nothing that hard to do, but when you're trying to keep up with everything, you just don't make it. Ends up being those things that fall through the cracks that you just don't do as much. So my overall takeaway is we just have to break away from status quo, and we've got to be able to find some creative solutions that result in better, more efficient care for our team members, more affordable, higher quality. And I wish there was a magic bullet, but there's not. So
There is not.
and I think it
but
will forever be a challenge.
Yeah.
I think so. But I think your idea about getting out with the people and really having those conversations,
Sure,
multiple, I think that is definitely something that
sure.
could help.
We think in general, our team believes us more than they believe a vendor. And so we've often wondered, and we just kick it around to say, what if we were and we don't have the expertise in-house, but what if we did? What if we decided to become experts in XYZ condition, or hire somebody who has expertise in those conditions? Would our team be more likely to take a call from Alison at Drury rather than Alison who works for XYZ company and is calling on behalf of Drury? So
Right.
I don't know. We're not doing that yet, but that's another consideration where we're trying to increase the take rate or the understanding of the many programs we offer.
Yeah, I think those are great ideas. So lastly, reflecting on everything we've discussed today, how do you see your role as a benefits leader in improving health and driving accountability in the healthcare system? I often say that you as benefits and HR professionals wake up every day focused on how you're going to deliver benefits to the thousands of employees and families that you're responsible for. Where I want you to wake up and think, how am I going to transform healthcare today with the leverage that I have? Could you speak to how you see your role as benefits leaders in the change we need to see in this country? And where do you see BHC fitting into this picture, and how can we help? Alison, take that one first.
For starters, our partnership with the BHC is invaluable, and that is a huge component of our ability to make all of this make sense. It kind of goes back to my job in many cases, not just benefits, but across all of HR, is to challenge those things that don't make sense. And trust me, there's a lot that crosses our desks that just don't make sense. And to encourage the team to step back, we always say, let's get up to 30,000 feet so we can see over the horizon, so we can try to anticipate what's coming down the pipeline and not just react to what's happening in the moment. And so I think the BHC is a really critical part of our ability to do that because of the connections that we have with the various St. Louis leaders and even outside of St. Louis. So that's a critical part for our ongoing learning and education. I know that we are better because we are members of the BHC and we trust our partnership. So I think at the end of the day, my job is to make sure that I challenge the team, help eliminate barriers, get creative, and surround us with people who are much smarter than us in all of these areas, because that's how we will get better. And the BHC is that resource for us.
Great. So great to hear that. Misi?
I guess I would say, so much of what we do is blocking and tackling, but then, we also have to represent what our folks are feeling and seeing and how they're interpreting and using their benefits, not only internally, so we can hopefully make the best decisions and bring the best programs, but also, out with the hospital systems and out with the providers as much as we can. And I think that's where, we couldn't do that by ourselves. So the BHC allows us to, group together with other employers and try and be that voice of the public to say, this is what we're seeing. This isn't sustainable. How can we work together to try and make a better healthcare system? I've been doing this for a very long time, and I think we've been having the same types of discussions, maybe with a little bit different words for the last 20 plus years. I think we've made some progress, but there's still a long ways to go. And a lot of it is just the bedrock of our healthcare system is very complex, and I don't think it's going to change easily. I think the Affordable Care Act shook it up a little bit and definitely made some changes, but we've got a long ways to go. And I think, it's my job to make sure I'm informed about what's going on and trying to be that best advocate internally and outside the company. And, the BHC and all of our other groups that we belong to like that definitely help us maintain that education and connectivity with the world.
Well, we are going to continue to be that partner for you as you navigate the complex healthcare system and the changes that we so obviously need to make to have a better healthcare system and better value for all of us. Thank you both, Misi and Alison, for joining me today and for your commitment to the health and wellness of your employees, but also your commitment to BHC and being on the board of directors, which is so helpful to me and all the members as you provide strategic direction for us. To our listeners, thank you for tuning in to this episode of Be Health Connected. The presentations from the annual meeting have been shared via email with all registrants and are also available on our website. We look forward to welcoming you at our future events where we will continue to bring you new ideas. Thanks for listening to Be Health Connected, empowering healthy workforces one conversation at a time.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.